Hi, this is Dr. Wedeking with Renew. I'm going to talk a little bit about what our possibilities are for full arch cases. For rehabilitating a full arch means you've pretty much lost all your teeth, or we need to extract some teeth that are diseased, and we're starting with a clean slate. So what are the options? Because now it costs money to get back those teeth, you want to know how they actually function. You want to know at what level do you need to purchase at. Most people within about a 6 to 8 month period of time can deal with an upper denture pretty well, but a lower denture does not work very well at all. And I would never give somebody a lower denture, without at least 2 implants to stabilize that. So going through this, I have a spectrum between no teeth or just a denture to as natural as possible on this side of the spectrum. So let's try to get over here. And basically the synopsis is, or the summary really is, the more implants, the closer to nature or closer to as natural as possible can be. Mainly because we're adding greater foundation. Think about your teeth. Each tooth has a root, meaning it has its own independent foundation. So implants are a little different. We can't always put one implant per tooth, but typically I have an 8 or more case plan that we do. It's called 8 or more, and that means we give you 8 or more implants. It doesn't matter, as long as we can get 8 or more implants. I can do 3-unit bridges, porcelain bridges, things like that, and individual crowns, and get you to as close to as natural as possible. Whereas, like I said, on the lower arch, the minimum is 2 implants. So that would be the lower end here, because your denture is going to flop around, and also the denture comes in and out. So there's a point in which things are not removable, and then all the rest are removable. Everything up to the 8 or more is basically a modified denture. Even a hybrid is a modified denture. All it is a bar on implants. We call ours a New Life denture prosthesis. It's made with the Trinia substructure, or we can make it in a cobalt chromium substructure. And those allow us to fix it on there, but that bar and that substructure is wrapped with a denture, essentially. The other types of bars would be a free-floating bar here, and the denture claps on top, and then you kind of go down the wagon where you have a denture piece that then snaps onto fittings. So I have on the website, we have the denture supportive, which means they'll be supported by the implants, and there's attachments called locator attachments or ball attachments, or the non-removable. So take a look at those. They'll be pretty clear, at least hopefully clear enough to help you to make a decision. The pricing goes accordingly. As you can imagine, as the bigger the prosthetic goes, the more expensive the prosthetic gets. The more implants you need, obviously it's just a cumulative amount of implants, costs them more than just a couple. So you can imagine going from the denture to as natural as possible, your costs going up, but your bang for the buck, the stability really goes up as well. So that's kind of it in a nutshell. Hopefully that helps you out with our website and looking at our alternative choices. Okay, thanks.